Are you terrified that a new curve, a strange bend, or a painful lump has changed your penis forever? You are not alone. Peyronie's disease is far more common than you think, and today I'm revealing the clinical roadmap to straightening your curve and restoring your confidence without jumping straight to surgery. I'm Melissa Hadley Barrett, nurse practitioner and sexologist, and in my clinic we often call Peyronie's disease the wonky willy syndrome. It's when your penis develops a curve or a bend or even a strange hourglass shape that simply wasn't there before. Now let's be clear. A slight natural curve is perfectly normal, but I have seen men in my office with a full 90-degree angle pointing up, down or to the side. The tragedy is that so many men wait far too long to seek help. They feel a sense of shame, thinking they've caused it through aggressive masturbation, or fear they've contracted an STD, or even worse, that the lump they feel is cancer. Let me reassure you, Peyronie's disease is a medical condition often linked to genetics or a minor injury that is triggered by an overactive healing response. To understand how to fix it, you have to understand why it's happening. Inside your anatomy, you have erectile chambers that need to expand evenly with blood. Peyronies is essentially the development of a plaque, a localised area or calcification hardening of the tissue. If you imagine a balloon and you put a piece of duct tape on one side and then you blow it up, the balloon will bend towards the tape because that section can't stretch. That's exactly what's happening during your erection. One side expands and the scar side stays rigid, and the result is a bend. If you're lucky enough to have an upward curve, it can actually be a G-spot stimulator in some sexual contexts. But when the curve becomes extreme, it stops being a feature and starts interfering with your ability to function. If you've been searching for answers on Dr. Google, please stop. You need a clinical diagnosis. If you're ready to stop the guesswork and start a structured, professional recovery, my online Peyronies program provides the exact clinical roadmap you need to manage this condition conservatively. You can find the link in the description. Now let's take a look at the research behind the 80% success rate of conservative treatment. Many urologists refer patients to me because I specialise in the conservative option first. We want to avoid surgery if we can. One of the most effective tools we can use is a traction device, like the RestorX. I know it looks like a scary medieval torture device, but I promise you, it's surprisingly comfortable once you learn the technique. It works through a process called mechanotransduction. By putting the tissue under constant, gentle spring tension, we usually signal cells to remodel themselves. We are teaching the scar tissue to relax and straighten out. If you're nervous about using a device like this, I highly recommend listening to my episode on the Penis Project podcast. I interviewed 2 men who used this device for months. Hearing their real-life ups and downs and how they fit it into their daily life routine makes the whole process much less intimidating. I always advocate for the conservative path first, because surgery often involves plication, which is tucking along the side, which can result in a loss of length. By starting with traction and medication, we often preserve or even regain length while fixing the curve. If after 6 months we haven't reached our goals, then we discuss surgical interventions with a clear conscience, knowing we tried everything first. Peyronie's disease doesn't have to be the end of your sexual confidence. It's a manageable condition, and the sooner you start treatment, the better your results will be. If you are ready to take action at home, visit my website and check out the Peyronies program. It gives you the exact roadmap my clinical patients use. And if you want to understand more about the mechanics of how the anatomy heals, watch this video on penile health next. I'll see you there.